another community engagement partnership that we wanted to be sure to highlight is our exciting work that we're doing with the Denver Housing Authority. And so I have my partner in crime here, Renee. We've been working together for over a year to get this partnership executed. Started with some relationship building pieces, and now we're actually in implementation phase. So it's very exciting. And maybe you can start by just telling the staff a little bit about the Denver Housing Authority.
Sure. The Denver Housing Authority provides affordable housing, subsidized housing for low and moderate income families across the city and county of Denver. We provide housing to over 11,000 families. Just over half of our housing is provided in partnership with Section 8 landlords, and then just under half is property that DHA owns. So we own 20 sites, housing sites across the city. 9 of them are family developments, and the rest of them are senior and disabled buildings.
So it was obvious to us that we would have a lot of crossover between our membership and the residents you serve, and that's part of the reason why Renee and I got to talking about, how might we be able to better reach our members. And Renee said, well, they live with us, right? So we started talking about what a partnership might look like, and we designed this model essentially where we would take a community-based care manager and fund that position here at the Denver Housing Authority. And that person is going to be hired here shortly, and we'll have a robust evaluation set up that will look at the activities that care manager coordinator undertakes. But some of the things that person will be doing will be connecting people first and foremost to eligibility and enrollment services at Colorado Access. So we've talked a lot about our AIMS team and how we can make sure that folks are immediately enrolled if they're not already enrolled into Medicaid or CHIP. Secondly, how do we get those folks attributed to a medical home? How do we make sure that they're seeking care at appropriate settings? How do we connect them to community resources? And then finally, if there's a more aggressive or a long-term care management need, how do we connect that back to our care managers at Colorado Access? And I think there's ample opportunity. We've discussed other types of OMFA events that could come here and do some, disease-specific educational opportunities. We've certainly enjoyed sponsoring some of your events as well. So it's a robust partnership that we have that I think both through the healthcare lens as well as the housing lens is a really promising one.
Right, and it fits perfectly into our dynamics because our department, resident and community services, supports all the 26,000 plus residents of the Denver Housing Authority. The residents break down to just under half are children, which a lot of people don't realize, and then about a quarter of our population is senior citizens or people with disabilities. So to try to serve this population to their best needs so that they can live independently, age in place, we provide 4 core areas of services. One is economic self-sufficiency. So for those families who just need the assistance to be able to transition to economic self-sufficiency and off of subsidy, we have very intensive programs for that. We have programs for youth. We have senior and disabled programs. So this fits perfectly, and it fits perfectly with the whole spectrum because health needs are affecting everyone's lives. And the 4th area is advocacy and community engagement. So this will roll out there so that we can target the entire population of the Denver Housing Authority. But what's very exciting to me about this project is that we will be able to expand beyond DHA to the community of Denver at large. So I'm very excited.
Which is an important region for us, right? We've talked a lot about how Medicaid is really moving towards this next phase of the Accountable Care Collaborative, and there's a particular focus on the social determinants of health, which is of extreme importance for the community engagement team in terms of our focus as well, and housing is a huge component of that. But more importantly, beyond just how do we prepare for the next iteration of Medicaid, we recognize that our members, your residents, are going to be better served as a result of our organizations coming together and collaborating and working with one another and creating those strong referral streams and relationships. And so we just thank you for your partnership, and we're excited to see where this goes over the next year.
Yeah, I look forward to it. It's going to be great.